Okay, so we are first going to talk with Allison Landreth. She's a pediatric-based speech therapist that I work with. So I have a few questions for her. You guys will listen to our conversation, and then there'll be some follow-up questions for you to respond to in the group discussion board. So first, thank you for participating.
My pleasure.
So tell us a little bit about what your discipline is and what has your career and the different settings that you've worked in looked like up to this point.
So I am a speech-language pathologist, which means that I can diagnose and treat any speech, language, swallowing, fluency, or cognition disorder, as well as pragmatics, which is social language. I worked in elementary school during the height of COVID, which was very interesting, and I'm in my 1.5 years at pediatric outpatient. I think also included in that was why I became a speech therapist. And the short, simple answer was I wanted to work with kids in the medical field, but I didn't want to be a doctor.
There you go. And where did you do your schooling? So a lot of my class is headed into graduate school for speech therapies, and at Eastern, obviously. So where did you do your school?
I did all of my school at Western Kentucky University.
Our tribal. So in our class, we've been talking a lot about interprofessionalism, the different types of teams, and service models that there are. We are an outpatient pediatric, which we've talked about in class, what that looks like in regards to referral process, populations we work with, and all of that. So tell us a little bit about what does interprofessionalism and working in the type of team that you do look like to you, and why is it important to you?
I think interprofessionalism and like working on interdisciplinary teams, because I think of the word interdisciplinary. And when I was in college, I think that's when the big kick of teaching interdisciplinary and kind of interprofessional work started. In college, I got to take a class where we worked with PTs. Here, I work more with occupational therapists. It's not unusual for me to work with our PT Sam, who I think you're going to hear from, on kind of a case-by-case basis, but OT, I do more co-treating, which is great in the outpatient setting because you can work directly with another therapist with a child. So let's say you're having a kiddo that has really severe sensory needs. Occupational therapy is able to come in at the same time as me, get that child regulated, maintain regulation, and then I can target what I need to target, whether it be speech or language, which really helps the session go a lot smoother. If you're thinking about going into speech therapy, I really recommend getting to work with occupational therapists or even shadowing an occupational therapist while you're still in school.
So looking at the school setting and the school setting and outpatient, you talked about PT and OT a little bit. What are some other team members for a child that you work with on a regular basis?
In the schools, and I think in First Steps, you're working more with like social work, or there's a point of contact for the family that might not be you, which might be special education teacher in the schools, social worker in First Steps, or in those early intervention kind of places. You're also going to be working with teachers directly in the school system. Parents, which are your number one stakeholder, should be included as a member of your team. Doctors, anyone that made the referral. Psych, we make a lot of referrals to psych in our office. Pretty much anyone that's involved in the child's betterment as they develop those skills, you're going to be working with them should the family give you permission.
So I know we're pediatric based, but looking across continuum of care, why do you think interdisciplinary work and interprofessionalism is so important for quality of care for patients?
We treat the whole person. I think that you get very stuck in treating the disorder that you are specifically trained to work on, but I shouldn't ignore a patient's, medical history if I know that they have, seizures, or we're working on that during swallowing, and I shouldn't ignore a child's sensory needs just because I'm not an occupational therapist. If the occupational therapist has told me how to best care for that child, it is ill of me not to put those things in place, and I can't expect the child to make progress if I'm only targeting L or chin tuck for a swallow, but not addressing all of their other needs that make up that person.
And I think it's easy to also to kind of get wrapped wrapped up in the busy day of like, oh, you recognize the issue, but really educating the family and saying, this is not my expertise, but I really think seeking a referral. I specifically can think of a kiddo that we share who we've been concerned lately about like GI issues and their diet and constipation. And I actually see the kid for feeding, but it's been a conversation that we both have had with the family to try and encourage them to talk to the doctor about seeking like a GI referral, or because the kid doesn't feel good, and then that's impacting our ability to do what is our expertise and what we are working on with the child. It like inhibits that progress. So again, yes, we've talked in class about how you don't treat just the disorder. You're looking at the whole person. You're looking at the symptoms and the impact that's going on in their whole life, not just in the setting that you're in. So what would be some advice to students still in undergrad or graduate school, because our class is mixed, and they're not all speech therapy based. We have some early intervention teachers too. So what would be some advice as they look forward to their next career steps, and then
I know we have like background music.
As they look at their next step, and then eventually treating in whatever kind of setting, or teaching in whatever kind of setting they choose.
I think my best piece of advice is kind of twofold: is to be open-minded about what you think that you want to do. I went into undergrad and then into graduate school thinking that I would be an adult nursing home clinician, and I've not done that with my career at all. I figured that out because I got to shadow and work in a nursing home and knew that it was not for me. I think that a lot of people get into a setting, think that it's for them, then think they hate the career, when actually it's just not the place that they're meant to be. So I would definitely shadow and intern in as many diverse populations as you can. Try to get a littles placement, try to get a school age, and then try to do a medical or a nursing home base, unless you're going into early intervention, which, great, that's fun.
I know, I feel like growing up, my mom's a speech therapist, and growing up, my exposure was always kids with autism, and that's what I thought when I thought about pediatrics and being a pediatric therapist. All I kind of thought about was autism, and once I got to school, I realized there was this whole other world of pediatrics, neuro, behavior, mental health, feeding, like all these different aspects, and I learned that through my shadowing and through different experiences that sometimes I had to seek out. They weren't always opportunities that were just required or put on by my school. A lot of them I was seeking just to kind of figure out where I wanted to be. So shifting gears a little bit from interdisciplinary and interprofessionalism work, we've talked also a lot in class about inclusion and why that is so important for the children that we work with, but also the families. So what has kind of been your experience with inclusivity and inclusion, if any?
I think that not necessarily in Eastern Kentucky, other than as far as bilingualism, I think that that's something that I saw a lot in grad school in Western. They support a lot of refugees, and in the elementary school that I did my internship, there were 23 languages spoken. Learning to work with an interpreter is kind of a tricky thing. I'm glad that I got that experience. If you ever have an opportunity to work at like a fair, I know that Western Kentucky hosted a fair for families of children who are refugees, and we did like hearing screenings. And so learning to talk to the patient, not to the interpreter, all that sort of stuff. Phone services for interpreters, very tricky. Something that's kind of a hiccup a lot of times is trying to get, you might be able to get a Spanish, you might not be able to get someone who speaks Burmese within 15 minutes. Around here, I think our biggest diversity is really education and the gaps in education or experience that people might have, and making sure that we're able to fill those gaps. I think of a story that my professor used to tell, where she used to teach parents how to read to their children, because a lot of parents don't may know how to read basic literacy skills, but not make the book interactive for the child. So teaching families something that you might think is, just second nature, making sure that you respect the family and let them know that you're just trying to make them as skilled as they can to help their child.
We talked a couple weeks ago about play and how a lot of times that kind of goes off what Allison was saying about literacy is we're teaching families how to play with their kids because some just don't. They don't have that experience and they don't have that kind of critical thinking piece to make play very therapeutic and fit for their kids. So, very. Why is inclusion important for the population that we work with?
I think that if you only create skills to work with a middle class family who comes from college educated parents, that's not all of what you're going to get. Especially I think in Eastern Kentucky, you're going to see some lower socioeconomic status. Maybe graduated high school, maybe didn't from the parents, and so I think maybe we don't think about language or different cultures as often, but those opportunities will come, and you need to make sure that you're prepared.
So now that I know, so you've been working in Eastern Kentucky about 1.5 years now, and you're from here too. So what would be, if the community came and said, what could we do to make our community more inclusive for the populations that you work with? What would be some things that you would love to see our community offer or resources added? Because you touched on it, we've touched on it in class, there's not a lot of resources around where we are.
No, and I definitely think parent coaching, that's something I would like to do once I'm further in my career because it costs money to get certified to do a lot of those courses. But like I said, I like to say experience, not education, because I don't necessarily care how far someone went in formal education. We don't have a lot of experience as parents with autism or Down syndrome, so creating groups where parents can meet other parents in person who maybe have children with those disabilities and then be able to learn as a group what they could do to best serve their child. And then I think you always think sensory play or like opportunities in parks to put augmentative, boards up where children can pick what they say. Moorhead, which is where we're located, has done a great job with the sensory parade and trying to make the community reach out a little bit more to those populations because it's not always easy to take a child who screams and a child who runs out into the park or wherever else. But I think that's also on us as community members to be good stewards too.
Well, thank you for talking to me and to them. Do you have anything else you'd like to say?
Best of luck.
All right, thank you.